In our Health Lead today, as President Trump continues to ignore his own health experts, break isolation guidelines, and prematurely promote coronavirus therapies, one key Trump administration scientist says he's had enough. Rick Bright was the director of the Biomedical Advanced Research and Development Authority, called BARDA. He was directly involved in developing a coronavirus vaccine when he was abruptly ousted in April after criticizing hydroxychloroquine, the drug embraced by the president. Bright was then reassigned to a narrower role at the NIH, and days later filed an extensive whistleblower complaint accusing the administration of prioritizing cronyism over science. But now Bright is leaving the federal government altogether and filing an amendment to his whistleblower complaint. This is his first interview since his Tuesday resignation. And joining us now is Rick Bright. Thanks so much for being here. We really appreciate it.
Jake, thanks for having me.
So it has been less than a week since President Trump was diagnosed with coronavirus, or at least since we found out that he was diagnosed with coronavirus. He's been ignoring CDC guidelines to isolate. He's been going into the West Wing, going into the Oval Office. He's been talking about how he wants to get back on the campaign trail, resume rallies. What's your reaction?
Well, it's unfortunate, but it's absolutely predictable. I mean, this is a president who has refused to follow public health guidelines, and unfortunately, he has encouraged others to ignore those same guidelines. I would say it's very predictable that sooner or later he was going to get infected, and his entire family and those closely around him are also going to get infected. So we're seeing what we would predict play out in real life.
Speaker Pelosi said today that the president is, quote, in an altered state right now, and suggested, quote, there may be some impairment of judgment due to the fact that not only does he have the virus, but he is on a medication, including a steroid that is known to have as a possible side effect effects on mood and irritability and judgment. Is she going too far? Do you think that he is in an altered state right now, potentially?
You know, what we're missing in this whole situation is transparency about really how sick the president is. We don't really have the truth about when he was infected, what stage of infection he's in. I don't think we know all of the various treatments he was given and what combination and what dosage. And so I would say anything's possible at this time. I don't think she's going too far. I think she has every right to be concerned about his behavior, about his response, and about his recovery, because we just don't know the truth yet.
It's true. They have not been transparent. They've been opaque. Why does it matter?
It matters because it's a message for America, it's a message for people around the world. We need to know what is wrong with our president. We need to know how sick he is, and we need to know what type of treatments he's getting so we can learn from that so other people will be able to follow the right example. The president is giving a very mixed message right now. He is not well. We would not want any other person on the planet to do the things he's doing this soon after knowing they're infected. And we wouldn't want someone up out of the hospital bed with these types of experimental therapies right now. So he's leading with a very bad example for the entire world, actually.
And how dangerous could that be theoretically? I mean, he is surrounded by, frankly, not a lot of guardrails. The people like General Kelly and General Mattis and others have long gone. And I don't know that he has anyone in his orbit who can tell him no, frankly. What does it mean if he's not thinking rationally because of the medication he's on?
It's very dangerous. He's in charge of a lot of things and makes a lot of important decisions for our country and for the world, actually. And if he's not in the right sound mind to make those decisions rationally, then he can be very reckless for our country and for the world.
There are at least now 20 people in the president's orbit who are infected with COVID. That's as many as we know about. There might be more. We still don't know, as you alluded to, we still don't know when he last tested negative, meaning we really don't have an idea of when he first contracted the disease. The only explanation I can think of as to why they keep stonewalling on this very basic question, when did he last test negative, which gives us an idea of when he caught the virus, is that the answer is actually worse than the spectacle of the continued stonewalling. What do you think?
Jake, that's the same behavior we've seen from this president since the start of the outbreak. He has never told us the truth about the risk or the seriousness of this outbreak. He has not told us the truth about his status or when he was infected. You're right. When you hide the truth and you're not transparent, you're hiding something much worse. And by hiding that, by lying to the American public and not telling us the full truth, you're actually prolonging the duration and the impact of this pandemic. You're actually allowing more people to die.
You say it's time for more scientists and more medical professionals, such as yourself, to lay your careers on the line and push back against how the president is handling this pandemic, as you did. Explain more what you mean by that and who you're talking about.
Jake, there are so many career scientists in our government healthcare system, and these are the best scientists in the world. I mean, I would put the expertise and the experience and the judgment of the scientists we have, the CDC and the FDA and the NIH and at BARDA, all throughout our government, up next to or against anyone on the planet, and our scientists are going to shine. They are concerned about this White House and this administration overruling the best scientific judgment. They are concerned about the political pressure that has been put on them to change a course of behavior, a course of action, or to rewrite science, or come up with some fake science and then put it forward as the truth. So they're very frustrated. I hear from my colleagues across our government, in the healthcare system especially, who are very frustrated. They're concerned that the truth isn't getting out. They're concerned that the best guidance and practices aren't being heard. And they're concerned about the lack of leadership, leading by example and encouraging people to follow those guidelines. So their frustration is because by blocking this information, by holding back their best evidence and their best guidance, then it is leading to more infections. It's leading to more hospitalizations. We have 30,000 people in our country right now in the hospital from COVID-19. More people are going to die because scientists are being pushed back. Scientists are not being heard. And I'm trying to speak up and encourage others like me in our medical field, in our scientific field, to speak up, because Americans need to know the truth. The world needs to know the truth. And if we continue to hide the truth, then we're going to see many more deaths that don't need to occur.
What is the truth that you're talking about that they're being prevented from saying?
This is a deadly pandemic. This is a deadly virus. The messaging that President Trump gave to America and the world when he left the hospital about there is no need to be afraid of this virus is probably the most reckless, deadly piece of information I have ever heard. This virus is deadly. It is airborne. And now finally the CDC is being allowed by the White House to tell the world it is airborne. It spreads person to person very easily. Look at the hot spot from that Rose Garden ceremony for the Supreme Court nominee. That one situation, how many people are now infected from that one situation? That's an example for America to see how quickly and easily this virus can spread from person to person. What they're not seeing is the number of people then that they go on to infect, the number of those people that go into the hospital, and then all we're seeing is some tallies, some numbers. And the numbers have a way of hiding the true feelings and life and the emotion, the family, the names of the people that are dying from this virus. The truth is, this is deadly. The truth is, there are things that we can and should be doing to reduce the risk, to slow the spread, to protect our healthcare workers, to protect each other, and to save lives. And the White House refuses to tell people the truth about those measures and their impact.
And you also talk about the politicization of this, the pressure on the scientific agencies to, for instance, when you filed your whistleblower report, it was about earlier this year, you were objecting to the fact that you were being pushed to act as if hydroxychloroquine was a cure-all, was a reasonable therapeutic, when in actuality, at the very least, it is not proven to be that way, and at the very worst, it could actually hurt people.
It's shameful what is happening from the White House, from this president and his senior administration officials, in pushing unproven drugs forward as a panacea, as a miracle cure, as a cure-all, as a gift from God, all the ways that they describe these treatments without any evidence behind them, and pushing them forward, encouraging free, wide access to Americans, in some cases where Americans didn't even need to be diagnosed with COVID-19. Knowing that these drugs could cause significant harm, these drugs could cause death even, it's reckless for the president and his administration to promote these. They're not scientists. They're not medical professionals. They're not healthcare professionals. The scientists know the truth, and their voice has been silenced. That is shameful from this White House.
Stay right there. We're going to come back to you. I want to ask you about the unproven therapeutics that President Trump is now pushing and the possible impact that that might have. That's next. Stay with us. To give this drug to every American free of charge. Is that possible? Is that wise?
It's too early to know if this drug really works. It's too early to know how safe it is and how effective it is. It's interesting that Regeneron is the first company that I put an agreement in place with in January at BARDA to rapidly start developing monoclonal antibodies for this coronavirus. It's a proven platform. It's worked for Ebola. They were working on it for influenza and for MERS. It made sense to start it with this coronavirus. However, they're just finishing some clinical studies. They put a press release out about a week ago saying they took a quick look and it looks good, it looks encouraging. But we can't allow press releases to drive our science or our clinical judgment. We can't allow a company to promote their own drug and all of a sudden start taking the drug. So it's important that the scientists get all of the data from Regeneron, review that carefully for safety and for its effectiveness, and then make the best judgment on whether or not that drug should be considered for an emergency use authorization. When you talk about making it available for everyone across America, that's very premature. We don't have much data. I think 275 patients were treated so far in the press release. President Trump is one person. He was on more than one drug. Actually, we have no idea what all he was treated with.
They still won't tell us everything that he's on.
So you cannot make a judgment that way. You cannot rush to judgment prematurely, especially as a world leader and make some announcement that this is a cure-all. He hasn't seen the data. None of us have seen the data. But it's not the first time he's done this. I mean, he thought hydroxychloroquine and chloroquine were miracles, a gift from God, a cure-all, miraculously going to address this virus. They weren't. He thought disinfectants were something we should look into. That wasn't a sarcastic comment. I watched it. I was horrified that I would get a call within a day at BARDA to start a clinical study or investigating how we could inject disinfectants. That was a real panic moment for us in science. And he prematurely pushed the FDA to give an emergency use authorization to convalescent plasma. We still don't have strong data. The NIH director, Francis Collins, and Dr. Tony Fauci have said the data is still out. We're not convinced that convalescent plasma is working the way they say it is, or they want to believe it is. So this president continues to get a small piece of anecdotal information from either his own personal treatment or from some friends of his.
Like the MyPillow guy who was pushing the oleander extract.
Yeah, that's scary. That is absolutely horrifying, and it does a disjustice to Americans and people around the world who hear him do that, because they're looking to him to be a leader, to be honest, and to guide them through safe and effective treatments through the pandemic. And he has done anything but that by promoting these drugs that aren't supported by science, prematurely pressuring the FDA to put an emergency use authorization in place, and then subsequently potentially causing great harm by making them available for people without the evidence to know who should get it, when they should get it, how much they should get it.
When you hear President Trump say that the vaccine is being delayed because of politics, and that's just politics, my impression is that it's actually the opposite, that it's politics from him pushing the scientists to act quicker than they want to according to protocols to keep us all safe. What is the reality here?
The reality is it's irresponsible and reckless for the President of the United States to drive the evaluation of something as critical as a vaccine to meet an election timeline. He is doing that. He's mentioned it on numerous occasions that he wants the vaccine before the election. There is no rationale and a scientific judgment to move that vaccine to meet that target date. He is not a scientist. He's not a doctor. I say let the scientists do their job. I can guarantee you, Jake, that there are thousands of scientists in our government today, thousands or tens of thousands of scientists in the companies around the world working on these vaccines who are doing the right thing. We need to give them time to do their work. Remember, vaccines go into healthy people to try to protect them from disease. We do not want a vaccine to cause harm in those healthy people, potentially more harm than they would prevent by preventing infection. So it takes time. Vaccines are very complicated to make. There's a lot of components, a lot of ingredients.
The president says he's just trying to cut through the red tape, that there's just too much bureaucracy. He's trying to push things around to save lives.
That's not true. Not at all. The scientists are working at breakneck speeds. It is unprecedented to see how fast they are moving through a lot of the steps. The one step you cannot rush is the safety evaluation of that vaccine after it's put into people. And that takes time.
Phase 3 trial.
This phase 3 trial.
Yeah.
Now remember, these people are getting 2 doses of the vaccine about a month apart. And it takes some time after you get that second dose of vaccine to see if anything bad happens. Now, we hope that nothing bad happens, but it doesn't always happen immediately. So all the scientists are asking for now, all the experts at the FDA are asking for now, is to give the vaccine time to enable us to see if there are any bad effects that we should be concerned with.
First, do no harm, the Hippocratic Oath.
First, do no harm.
Let me ask you a question. When you filed your whistleblower complaint earlier this year, and then you were reassigned from BARDA to the NIH, there were a lot of critics from the Trump administration of you, alleging that you don't manage your office well, that you mistreat staff, you fail to consult your superiors. I could go on and on. But let me just cut to the chase here. Do you have an axe to grind here? Are you a Democrat that hates Donald Trump because of what he stands for? Why are you speaking out like this?
Jake, I'm a scientist, and I have dedicated my entire life to trying to save people's lives. I've dedicated my career to studying pandemic outbreaks, to focus on development of vaccines and drugs and diagnostics. Response, every facet of responding to a pandemic is what I have dedicated my life career to do. And when this pandemic started, I sprung into action. I found out that I was moving light speed ahead of this administration. Before they were willing to admit we had a problem, I had plans in place to try to make a vaccine. I had plans in place to start drug development. I had plans in place to work on diagnostics and tests. We knew what we had to do. But this administration refused to admit it. So I was, I think in their eyes, a fly in the ointment, because I was pushing for the inevitable, this pandemic that was emerging. All the signs were there. I had no doubt in my mind, and scientists like me had no doubt in their minds about where this was going once we saw what was happening in China. And this administration didn't want to admit it. When I sounded the alarms to make masks to protect our healthcare workers, they resisted. When I sounded alarms to start vaccine development, they resisted. When I sounded alarms to buy swabs, the essential component for the test, they resisted. So when I spoke up about the dangers of chloroquine and hydroxychloroquine and the recklessness that our public health political officials were doing to push this drug out, to flood the streets, is the note I saw from the White House. Directive, flood the streets. That was the straw that broke the camel's back for me. I could not sit by and be complicit and watch people in danger, and watch people die. I had to speak up. When I did, they pushed me out. 25 years of vaccine and drug and diagnostic development kicked to the curb. To the NIH, demoted, ridiculed, as you said, disparaged in every way, called a deserter. My record speaks for itself.
Stay right there. I have more questions for you. I'll be asking more about the whistleblower complaint and why Wright says this winter could be the darkest winter in modern American history. Stay with us.
We've often wondered what keeps the...
We're continuing our interview in our You just heard senior vaccine scientist Rick Bright say that more Americans are going to die from coronavirus because scientists are being sidelined by the Trump White House. 6 months ago, Bright filed a whistleblower complaint claiming he had been demoted from his job at the Department of Health and Human Services for complaining about political interference in science. This week, he resigned from government altogether. This is his first interview. You faulted specifically political operators in the Trump administration for not taking the pandemic seriously enough. Who specifically are you talking about? Are you talking about HHS Secretary Alex Azar?
Absolutely. I think it cascaded all the way down from the White House, from the President Trump to the Vice President. Those on that White House task force moved into the Department of Secretary Azar and the Assistant Secretary for Preparedness Response, Dr. Bob Kadlec.
Last night, Vice President Pence would not answer the question when asked by Susan Page as to why the death toll for coronavirus is so much higher in the United States than for any other country, and our death rate is higher than for any other wealthy country. As someone who is inside the administration, can you answer the question? Why? Why are we doing so much more poorly than any other comparable country?
Because of failed leadership. Because of a reluctance to admit there was a problem, because of a reluctance to tell America the truth, because of a reluctance to take critical actions up front. It disgusted me last night to hear Vice President Pence try to say that President Trump did all he could by putting in a travel ban from China in January. That is the only thing they actually talk about that they ever did. That alone was so insufficient to get in front of this virus. They don't recognize that many people, hundreds of thousands of people, were already coming into our country with this virus. So that one small travel ban, that's the only thing they hold out that they did, was not enough. And they deny the fact that if you do take a step, such as a travel ban, that is called an attempt to contain the virus outside the country. When you contain and try to hold off the spread of a virus, you must be doing something else in the background to prepare for a breach in that containment. The virus breached that containment very quickly, and we weren't doing anything else to plan for mitigation. And that is where this administration failed most.
In May, you said this could be the darkest winter in modern history. It's now October. More than 211,000 Americans have been killed. More than 7.5 million have been infected. Cases are going up or staying steady in most states. What are you afraid is going to happen in November, December, January?
This winter, we're going to have an explosion of cases of coronavirus. This winter, we're going to have an explosion of influenza infections and other respiratory infections. It's going to overwhelm our healthcare system again. We still don't have enough personal protective equipment for our doctors and nurses. We still don't have enough tests. We're still not doing enough testing. We still are not delivering and leading by example those critical measures. So one of these things, coronavirus, is going to be compounded by influenza, compounded by other respiratory viruses, and it can be absolutely disastrous. And it doesn't have to be.
Last question, sir. It sounds as though you're saying that President Trump has blood on his hands, the blood of tens, if not hundreds of thousands of Americans. Is that what you think?
I believe President Trump and this administration has failed America, failed to respond to this pandemic, and many people have died needlessly. There were many lives that were lost that we could have prevented. And there are many more lives that we're going to lose this winter that are preventable if we just had strong leadership, we just had truth and transparency coming from our White House and people who lead by example. So short of them doing that, it's criminal. More people will die. And I believe that from the bottom of my heart.
Rick Bright, thank you so much for your time. We really appreciate it. Our other breaking news today, the Michigan governor is pointing her finger at President Trump after the FBI stops a plot to kidnap her and overthrow the government. Stay with us.